Hello, everybody. Dr. Arzi here from Veterinary, Friday, November 22nd, 2024. We are going through this issue of veterinary surgery from 2015. We're talking about internal fixation of severe maxillofacial fractures in dogs. University of California in Davis. Objective to describe internal fixation for maxillofacial fractures using titanium mini plates and report outcomes in 7 dogs. Internal fixation is when the bones that's broken are repaired by placing implants in the body, and external fixation is where the same repair occurs, but the implants are outside the body. For those who don't know, this is a prospective study. CT evaluation performed. They used a combination of extraoral and intraoral approaches. They used non-locking titanium mini plates. So non-locking means that when you put the screw into the bone plate hole, the screw hole, that the ridges of the screw does not lock into the plate. And then the titanium aspect to it, most people think of implants being like stainless steel or a hybrid, which a lot of them are. Titanium is great because it's biologically inert. It's strong, but also you can bend it. And mini plates just mean that they're very tiny plates, obviously by the name. They use non-locking titanium screws, and then they create a soft tissue envelope for repair. Results: fractures healed rapidly, immediate return to normal function and inclusion, excellent long-term function, lack of complications. One dog had nasal aspergillosis, which is a fungal disease, 1.5 years after surgery, and they removed the implants because of the infection. So introduction: the maxillofacial complex in the dog is the most prominent part of the skull, rendering it vulnerable to severe injuries. Indeed, most maxillofacial fractures result from trauma, like blunt trauma from hit by cars, horse kicks, impact. The term maxillofacial, it refers to incisive, palatine, zygomatic, lacrimal, frontal, and nasal bones, and as well as maxillary bone proper. This region is located between 2 strong craniofacial bony structures, the cranial base and the mandible. Biomechanically, the maxillofacial structure can be thought of as a strong but lightweight frame made of thin bones and large airy spaces of nasal cavities and paranasal sinuses. The maxillofacial frame is strengthened by buttresses or projecting support that maintain the position of the maxilla in appropriate relationship with the base of the skull and the mandibles. Many plates have been used for maxillofacial osteosynthesis in people as part of an orthodontic surgery since 1970s. Plates are typically applied using a tension band principle, providing buttress support. Stainless steel plates to titanium have been used because they're lightweight, they're elastic, density similar to bone, and they are biocompatible. They have excellent osteointegration. Boudreau, which is a study, used mini plates for maxillofacial fractures, achieving excellent function in cosmetics, and has reported important considerations when you place it in dogs. Materials and methods. These comminuted and displaced maxillofacial fractures were defined as panfacial if there were at least 3 bones affected, and localized if it was 1 to 2 bones affected. And then here is a 3D CT scan of a dog. You can see the fracture fragments there. See all that there, and then the real pictures. And then you can see on the bottom there, or is it over here? That gold thing is the mini plate, and they're placing it on the, in this case, on the zygomatic arch, which is fractured. That's the cheekbone area. Reconstruction of the orbit was also considered a priority, as well as reconstruction of the nasofrontal wall if compromised. Finally, if the alveolar processes were involved, restoration of normal occlusion was planned. And then this is a CT scan post-operatively. You can probably see the tiny right over the nasal area, right there. Tiny implants that are there, and on this view, those bright white dots, those are all implants. And then on the real life picture of the dog, they place a stent bandage over the area so that air buildup from ruptured sinuses and trauma doesn't cause a slight blowhole effect. Put the stent on there, and it'll apply pressure to the area. They avoided tooth-root damage. Screw length was assessed by CT using bone thickness measurements, and also in surgery using a depth gauge. They used at least 2 non-locking self-tapping titanium screws. Tapping a bone is when you have to manually create threads in the bone so that when the screw is placed, it'll fill those threads. Self-tapping, it does that for you. The screws are built in a way that they will tap as you place them in the bone. What that allows is it's more precise, but also more importantly, it's not prone to human error, and it skips a step for the surgeon, which means less anesthesia time and a faster surgery. They used ampicillin, 20 mg per kg IV, and then clavamox to go home with, 20 mg per kg, 1 to 2 weeks post-op. Results. There were 7 dogs, 37.6 months of age, 30.5 kilograms. 1 had a car accident, 3 kicked by a horse, 1 fell from a moving truck, 1 ran into a fence pole, and 1 had a trauma with a vineyard trimmer. Follow-up was a mean of 37 months. Time from admission to surgery was a mean of 29.5 hours. All dogs had a skin laceration or a defect over the fractured area. The bones repaired included zygomatic arch, frontal bone, maxilla, nasal bone, incisive bone. 1 to 5 mini plates were used for each dog. Clinical evaluation. They had appropriate occlusion. Pan-facial fractures were identified in 5 dogs. 2 had localized. The pan-facial fractures warranted surgical intervention because of the extent of displaced comminution, displacement of bone fragments into nasal or frontal cavity, and ocular displacement. I'll say right off the bat, it'd be great to have a study that compares pan-facial versus localized maxillary fracture repairs to see if the number of fractured bones plays a role in prognosis. Both local fractures involved the zygomatic arch, which was immediately displaced, causing dorsal displacement of the eye globe and soft tissue entrapment. Okay, follow-up diagnostic imaging. They had follow-up CT. They showed fracture healing, remodeling. Internal fixation appeared static without any implant issues. 1 dog had excessive bone formation at the level of the nasopharynx and choana, which caused nasal discharge, but it decreased over 4 years and basically became resolved. Another dog developed a nasal infection with a fungus, and they had to remove the implants. Here's another CT there on the bottom. You can see the very, very tiny plates on that dog's nasal cavity there, nasal bones. All right, discussion. This technique avoids the need for external fixators. It had a quick return to normal function, normal eating, normal drinking, excellent cosmetics. The plate and screw system selected was locking because the plates are easier to contour to the complex maxillofacial anatomy. Non-locking screws also allow for angling the screws. So if you're using a locking screw, when you put it into the bone or into the bone plate, it's going to lock in there. So it has to be straightforward 90 degrees. You can't angle the screw. If you're doing non-locking, then the screw can be angled in whichever direction you want with some limitations, but it allows you way more freedom. Several aspects of the concept of surgical repair with internal fixation are important. These include the appropriate time after trauma for treatment, the age of the dog with respect to skull growth restrictions, selection of internal fixation rather than more conservative approaches, selection of internal fixation rather than more conservative approaches, and the need for mini plate removal. Mean time in this case from trauma to surgery was 29.5 hours. Studies and reports, and people consider early repair occurring within 48 hours of admission, delayed repairs over 48 hours. Importantly, delayed repair does not increase the length of hospitalization, has a negligible infection rate, and similar complication rate to early repair, meaning that you want to stabilize these dogs before you rush into surgery. Stabilize them, make sure they are cardiovascularly, hemodynamically stable, and then they can tolerate sedation, anesthesia for CAT scan, surgery, etc. So you can give it some time. Skull growth in skeletally immature dogs could be severely restricted and influenced by internal fixation. In skeletally immature patients with severe maxillofacial trauma, a minimally invasive approach with minimal disruption of periosteum and skull sutures is advised. Preservation of the periosteum is very important to allow a more favorable environment for bone healing. If these fractures are not treated or treated conservatively, there could be potential long-term complications with bones dislodged into the nasal or frontal cavities like sequestrum, refractures, facial asymmetry, trismus, diplopia, anophthalmos, axophthalmos, and paraparesis. Furthermore, limited or no fixation would result in subsequent cavitation with connective tissue scarring and permanent consequences for functionality and life quality. Removal of the plates is controversial in oral and maxillofacial surgery. Concerns associated with permanent retention of implants at the Healed fracture sites are generally corrosion and fretting corrosion between mini plates and screws. Basically, for all intents and purposes, rust formation. But there's no evidence of corrosion occurring in mini plates and screws made of titanium. It's pretty remarkable metal. Regardless, implant removals indicate if there's infection involving the plate, if there's clinical irritation, or if there's dental root damage or other causes. And that's it. Pretty quick study, straight to the point, excellent outcomes, very cool. Love to see another case study comparing panfacial and localized. It'd be great to have more dogs involved. Yeah, and so pretty cool. So thanks everybody who watches in the playback. We'll be back again tomorrow for another live stream. Take care.